Very good morning, everyone. So today I'll discuss about a very basic yet most important skill that an obstetrician needs to know. Actually, in my last OPD only, I saw one of my PG struggling while calculating gestational age or period of gestation of an obstetric patient. So, if you cannot calculate dates accurately during pregnancy, or you cannot date a pregnancy right, many of your decisions that you are going to take during the course of pregnancy are going to be affected adversely, like induction of labor or termination of pregnancy. Like if a lady come with preterm labor, it is actually a preterm pregnancy or not. So management of all of this depends on the accurate calculation of gestational age or the period of gestation. So I thought this basic thing should be known to all residents who are working, and as well to the obstetrician who are doing general obstetrics practice, that how to calculate accurate gestational age. So, when we talk about accurate gestational age, we all know that the most accurate calculation happens in first trimester. When the lady comes to you first time in first trimester, that is the first time we calculate dates. And if her menstrual cycles are regular, like they are within the limit of 28 to 32 days, and the cycle does not vary more than 5 days early or late, then you can say that okay, these are the reliable cycles, these are the good cycles. And if you calculate expected date of delivery by these type of cycles from the first day of last menstrual period, these are called as this is called as excellent dating, if the dates are very much reliable. So if a lady comes to you with a good cycle, with a regular cycle of 28 to 32 days, and she tells you that the last menstrual period was on this date, first day of the last menstrual period, that we take as LMP, then you can calculate the expected date of delivery or EDD by Naegele's formula that we all have been doing. What we do in Naegele's formula, we just write down the LMP. Like if the LMP is, suppose, 15 July 2023, and then what do we do in Naegele's formula? We just add 7 days to that LMP, right? So 15 July we add 7, so the EDD date would be 22nd. So 15 plus 7, 22. Then the month, we add 9 months to the last month. So last month was this July, so we would add 9 months to it. It would come on in April. So the expected date would become 22 April 2024. So this is how Naegele formula work. Or the easier way is to go back. For date, you add 7 days to the LMP, and for the month, you go back by 3 months. So if the LMP was on 15th July, you go back by 3 months. That would be June, May, April. So the month would be April. So that would be 22nd of April 2024. This is the simplest way to calculate the expected day of delivery if the dates are reliable, dates are good, cycles have been regular. Then only you rely on this Naegele's formula. Then what is the other way? If the lady is not sure of her date, she has forgotten her dates, then what do? The best way is to calculate the expected date of delivery by first trimester ultrasonography between 7 weeks to 13 weeks. So CRL by CRL, ground rump length. So on USG you see by CRL how much is her gestational age. So that is the best method. And if the difference between the gestational age in first trimester USG and the gestational age which you have calculated by LMP relying on lady's cycle, if the difference in this is more than 5 days, then you go by the dating then you do the dating by first trimester ultrasonography, not her dates. Then the dates become unreliable. Even if she says that her periods were regular and she exactly remembers what her LMP was, then also you do not take her dates to calculate EDD or the gestational age. You take the first trimester ultrasonography report and you calculate gestational age as per that first trimester report, right? So this gestational age calculation or the dating or the calculation of the expected date of delivery, once you do it in first trimester, you do not change the EDD, right? Either you have calculated it by her excellent menstrual cycle history, or by USG, or by the combination of both, then you would definitely not change this EDD during the course of the pregnancy when she comes next to you. The EDD remains the same. You just add on the days on which you next see that lady. That is important to diagnose cases of fetal growth restriction accurately. This is very important that you do not change the expected date of delivery after first trimester. So you always go back to your first trimester notes. Second important thing is every time the lady comes to you, please cross check the gestational age. Even if you have been doing it on every visit, you may have been wrong last time. So always redo it at every visit. And even if the dating has been done by some of your seniors, your teachers, please do not, I would not say rely on them, but you always calculate your own dates whenever you see that patient, because everyone can, make mistakes. At that particular time, that person was in what status of mind, you do not know. So please calculate your own dates whenever the lady comes to you. So this was regarding the first trimester, how to calculate gestational age or how to calculate estimated date of delivery by first trimester history, her menstrual history and the USG report. Then we come to the next visit, second trimester or third trimester. What if this lady comes to me today? Today is what date? Today is 18th of January. She has come to me on 18th of January and I need to calculate her gestational age on 18th of January. How do you do it? So her last menstrual period was on 15th of July, right? You calculate the gestational age from 15th of July till 18th of January. So how do you do it? So in July, how many days? You always take this last menstrual period date also in calculation. So if we count from 15th of July till 31st of July, July has how many days? From 15th July would be 17 days. Because July has 31 days, right? 31 minus 14 days. 14 days have already gone. We are calculating from 15th of July. So 14 days of July are already gone. So from 15th July, so 31 minus 14. So it would be 17. So 17 days of July we are calculating. Then August. Then how do you take the other months? Right? If the month is of 31 days, you take it as 4 weeks, 3 days. If it is of 30 days, you take it as 4 weeks, 2 days. And if it is of 28 days, you take it as 28 days. Then you take it as 4 weeks. So I tell you, many of the obstetrician I have seen, what do? They either take all the months as 30 days or they take all the months as 4 weeks. So it is not like that. When you calculate gestational age, even a single day matters, because when it comes to induction of labor or management of a preterm pregnancy or management of fetal growth restriction, even these 2-3 days matter. Right? So please do not leave those days. Do not take a month as 4 weeks. because there are 3 days or 2 days extra in every month, and if you add on all of them, it becomes like 2 weeks approximately, if you add on them throughout the 9 months of pregnancy. So that is not a little time, it is a very significant time that you are missing out here. So always take care of this thing. Then when the month is of 31 days, you take it as 4 weeks 3 days. When the month is of 30 days, take it as 4 weeks 2 days. And when the month is of 28 days, take it as 4 weeks. So in July, 17 days. August, 4 weeks 3 days. September, 4 weeks 2 days. October, 4 weeks 3 days. November, 4 weeks 2 days. December, 4 weeks 3 days. And today is 18 January. So as 18 has still not gone, so we do not calculate today, right? We'll calculate till 17th January. So 17 days of January. So 17 days of July, 17 days of January, that is 34 days, which means how many weeks? It means it is like 4 weeks and 6 days, right? 4 weeks and 6 days. So you add 4 weeks 6 days in this, right? So you started with 15 July and today is 18 January. So from July I took 17 days, and in January I took 17 days also, because today is 18 has not yet gone, so I've taken only 17 days. If we add on these, it will be 34 days. What about other months after July? August, September, October, November, December, right? And these 34 days we converted as in 4 weeks 6 days. So we add all of them in weeks 1, 2, 3, 4, 5, 6. So 4, 6 are 24 weeks. Then we add these days, 3 to 5, 3, 8 to 10, 13 and 6, 19 days. So if you convert 19 days into weeks, 2 weeks, 5 days. So 24 weeks plus 2 weeks, 5 days. So it would be 26 weeks, 5 days. The lady's accurate gestational age would be 26 weeks, 5 days as on 18th of January. So this is what I wanted to focus on, that you should not leave even a single day in a month. If the month is of 31 days, it is 4 weeks 3 days. If the month is of 30 days, it is 4 weeks 2 days, right? So whenever you, and also whenever you calculate the gestational age, you always include the date of last menstrual period, but you do not include the date on which you are calculating the gestational age, because that day has not yet gone. So you will be calculating only till the previous day, right? So this is the right method of calculation of gestational age. So what if there is one more point that I wanted to highlight, that on the day of EDD, if the lady has come to you like in OPD at 10 a.m. and today is her EDD, we say that it is 40 weeks on EDD, but only if that day has gone. If she has come to you at 10 a.m. and today 18 January is her EDD, then she would still be 39 weeks, 6 days. She will be 40 weeks only if that particular day has gone. So this is also very important. Please do not add that day on which you are calculating into the calculation of your gestational age.